Hello, my name is Bakar. My unknown microbe number was 6A. So to get started, my patient's name was CJ, and she was an 89-year-old female patient who lives in a nursing home that is assisted with care. She has a history of osteoarthritis and mild dementia. And one day she was having hallucinations in her daily yoga, and so when one of the staff members noticed this, she reported to the physicians. And to take action, the physicians ordered a urinalysis and blood work. One of the first tests we did was a gram stain, and what a gram stain basically is just to see what your bacteria is, if it's going to be a negative or a positive. And for this case, for my unknown, I was gram negative. It was a gram negative. And to determine whether it's a positive or negative, you have to see the color and basically any sort of shape that you see. So for me, there was red, tiny smear dots. So this resulted in me having a negative. But if you see any color of purple, then that means it was a positive. So I had a gram negative. Now, for the biochemical tests that I mentioned out of plenty were the PEA, lactose fermenter, citrate utilization, and the catalase. And in this next slide, I give a good visual of the other bacteria compared to the tests I just mentioned. And what each of these tests do, I will tell you. The PEA test is used for the isolation of gram-positive Staphy species and strep species. Lactose fermenter is used for the difference from lactose non-fermenting gram-negative bacteria. For citrate utilization is to determine if the bacteria has the ability to grow aerobically with sodium citrate. The catalase test is to determine whether a gram-positive cocci is a staphylococci or a streptococci. So, as we can see, for my unknown, it was positive for these 4 tests here. These are the 4 tests all listed. So there's PEA positive and PEA negative right there. So my unknown was positive for PEA, unlike E. coli. My unknown microbe was positive for lactose fermenter, unlike E. coli and Salmonella. So this is to give you a nice representation of the other bacteria. So possible diagnosis, because my patient was experiencing hallucinations, this wasn't uncommon. Because she had a history with dementia, this was not out of the blue. Now, from research and from the physician who ordered the blood test, I believe this has to do something that involves with her bladder. I believe there's E. faecalis coming from her bladder, and from this bacteria, it can come from anywhere that it involves poor hygiene. So with a person who had dementia, they probably forgot to do certain things, and forgetting to do certain things, was probably stuff that had to do with hygiene. I'm not saying she has dementia now, but because she's having these hallucinations, maybe there's that has to do something with her hygiene. Maybe she's not washing her hands, or maybe she's not wearing the clean clothes she's supposed to, something along with those lines. Now, symptoms. I believe this is UTI very strongly because from my research, behavioral changes such as hallucinations can be a symptom to this disorder. And also I searched up and I found out that 90% of UTIs are gram negative. So this just backs up my point to maybe this might be the disorder for my patient. And treatment for UTI can be antibodies such as doxycycline, amoxicillin, and nitrofurantoin.